Hi, I'm Dr. Jennifer, and I'm here to talk about low-dose antigen therapy and low-dose immunotherapy that we offer here at Singing River. And low-dose antigen therapy and the immunotherapy are pretty similar. The antigen therapy is similar to allergy shots, but they're much more dilute and they're given much less frequently. The idea behind it is we're going to be introducing an antigen or something that might produce inflammation in the body or an allergic type of symptom to your immune cells in your skin when we do an injection, or to your gut. Sometimes we'll do them sublingually, so that it can reintroduce it to the more active immune system. We're trying to modulate the immune system so that you have less of a reaction to environmental sensitivities, to allergens, just like pollens and things like that. But also sometimes to the other types of inflammation, even kind of autoimmune stuff, headaches, sometimes ADHD, pandas. So in general, we're just trying to help the immune system so it's not overreacting to either a food or an environmental allergen, or maybe an infection. And that's the difference between the low-dose immunotherapy and the low-dose antigen therapy. So the immunotherapies, we're doing something that's more infection-based. So generally, we're doing either inhalants for environmental stuff, which includes things like mold and fungus and pollens, cats and dogs. We might do ones for food, so if you have reactions to food, including IBS stuff, but also maybe symptoms of maybe behavioral issues, or again, autoimmune type stuff. And then I have chemicals as well, and that's for people who have a lot of chemical sensitivities or getting exposed a lot to perfumes and stuff in the environment, and they seem to start getting super reactive to it. So the dose is done every 7 weeks, and we do minute doses coupled with an enzyme called beta-glucuronidase to activate the immune system in this case. It's much more dilute than allergy shots, although it's kind of similar. In the low-dose antigen therapy, people don't have anaphylactic reactions to the LDA. They may have a little bit of a topical reaction, like maybe a hive or something. So anyhow, we're gonna do Jonathan here. Today. I'm gonna give him some low-dose food because he had the inhalants earlier. And we're gonna just take a little insulin syringe. We're gonna do it as an injection. I'm gonna give him a wee tiny bit. I mean, literally, it's a wee tiny bit of the beta-glucuronidase, and then I'm gonna do a low-dose food for him. Now, generally, when we're doing food, LDA, there's a special diet that is followed for at least 24 hours before and 24 hours after. But we're not doing that today because here we go. So here's a shot. It does have a little bit of a sting to it, and that's it. You can see it really, usually there's no bleeding. Sometimes you get a little bit of a hive in the spot. Some people will report feeling better almost immediately afterwards. Sometimes it takes a couple days. When we're doing the LDI, the low-dose immunotherapy, where we're actually doing more pathogen or infections, microorganisms, we have to find a right dilution for a person, so kind of something that matches your system. So finding the right dilution sometimes takes a couple of trials. But we do them every 7 weeks. Some people will come in for a booster in the meantime. Oftentimes people will report feeling better, especially like environmental allergens and stuff, instantly, or within a couple days. So anyhow, that's it. Thank you.